I put together just a quick item to show you, to illustrate what Termite Terry said with this kind introduction. Something that one of my newer pieces of equipment that I have acquired. It's an electric hand tube. Oh, wait a minute.
How fast does it go?
You know, when you go to the dentist and they start drilling, they have the real loud whine. It's actually damaged my ears through the years. I've been a dentist for 45 years. And that plus the guns and the pistol team, that didn't help. Even though I wore earplugs and earmuffs at the same time. But did damage my ears, and a lot of people have complained about it. But this new drill is all electric, and there's no air in it. It does not run on the windmill principle. There's an electric motor that turns it, and it gets up to 200,000 RPMs. And it's excellent.
What's it do, 0 to 60?
Best drill in 50 years. I mean, that's what a woman told me. I mean, it's just a joke. But the new drill has more torque, won't bog down. JT just got that 2 minutes later. You know, less vibration, so it cuts more smoothly. Has variable speeds, much less noise. And that's the little pad that I can use to vary the speeds. And the speeds come up and talk to you what you're going to do with it. And that's the old one, the old air drive. And you see how small it is. Sometimes in a very tight place, the old one still is better because it's smaller. But for most jobs, and for jobs that require a lot of drilling, this is way better. It's smoother, less vibration, not as noisy, and my hand isn't tired at the end of the procedure. So, USC, this brand has been installed at the dental school, and it was tested by a famous professor. So it's all good. So that's talking about equipment, and we use it for all aspects of dentistry. I have 2 practices. I have a general practice where I take care of general dentistry for normal dentistry, everyday dentistry. And then I have a TMJ practice that is really thriving. And I tell my wife that even though I'm old, I'm still peaking because the TMJ practice is peaking. And
She buys into that?
Does she have a choice? So I'm going to show you a case now that
Oh, there you go.
this is all a bit much for if you're a non-dentist, but what you can see as a non-dentist is after I treated the patient, her bones actually got better. These images are 1-to-1. So if you look at this image here and this image a couple of years later, her bone actually changed. The bone around it changed. This is the base of the skull. So the base of the skull actually healed, and the jaw joint actually bone changed. And it's probably illustrated best in this cut right here, where you see the bone was thick. The bone was thick because it was being hammered, and after I corrected her bite, the bone is thinner which is more normal, and isn't as white. When it's white, it means it's hypercalcified. It's too much calcium. Now, if you look at the shape of these little round areas, the work that I did, the treatment actually helped the bone to heal and change. And it's very remarkable. It's so remarkable that when I showed this to a radiologist with a master's degree, then studying x-rays of the head and neck and the jaws, he said he hadn't seen this phenomenon before. So I asked him, well, what do you call it? He says, I don't know, because I'd never seen it. And I said, this is the 5th case. So I had access to my laptop when I was talking to him, and I showed him the 5 other cases, and he said, this is very remarkable. So we're going to exit here, and we're going to go to the so this is the patient's profile. You look at the curvature of her spine and look at the head position in relation to the neck. And after I fixed her bite and made her comfortable and the pain went away, her head came up straighter, her shoulders came back, and it made her breast look larger. A woman actually asked me if she had a boob job. I said, no, she's just standing up straight. And so it looks nicer, the spine is straighter. The shoulders are back. That's what makes the breast appear to be larger. So I didn't understand this, and so I called up a physical therapist that I work with, and he told me when these muscles are tense the wrong way, this is what happens. But when they're relaxed, the good muscles contract and straighten up everything all the way down the spine. Because the muscles that move your jaw backward and forward are attached right here on the spine. So when you fix that, you get well. And I have a patient that's a chiropractor, and I showed him these pictures, and he said exactly the same thing. When you get the back fixed, the neck fixed, it can go down the spine. So, I mean, I didn't predict this was going to happen. I just observed it, and I sought information from other professionals, and they told me that this is what happened. So it's all good. So now we're going to X out here, and we'll go to another case. Because of privacy, because of privacy, we're only going to go to the pictures. And you can see the change in her face. This was swollen. This wasn't swollen. And she did very well. Part of her problem, she was wearing a device that was not correct. And these pictures show her teeth after 2 weeks. See how far apart they are? They got closer together. And here they're closer together. Just by not wearing a device that was made incorrectly. 2 minutes, yeah. You sound like my wife. 2 minutes, yes. These are all old jokes I've told.
Oh, yeah.
See how she closed? And that's knowledge. I didn't treat her. My treatment was to tell her, please don't wear that device. And she got better on her own. So knowledge is power. And she has to go to an orthodontist, etc. But more, see again, new pictures to show the decrease in swelling. And also her left shoulder is straighter. Her left shoulder used to be pushed up. See how you can see the shoulder here and you can't see it there? Now they're even. So the head can't change, the shoulders change, and then this shows the teeth. And this shows how happy we both are. Okay. Well, I think it's a quickie. I hope you enjoyed it, and you can tell even though I'm old, I still have great enthusiasm for the dental profession. So thank you for your attention.